This taping technique is useful for some types of pain at the front of the knee involving the patella femoral joint. It's called a McConnell tape. And this is how you do it. You've got your femoral or under tape. This just helps the tape stick a little better. And you want to find where your patella is. Your patella is your kneecap, and it's kind of shaped like a triangle. So at the top of the kneecap, you've got your two top border, and then the inferior angle is underneath here. And so there's slightly different variations with this tape, but we'll just start with a kind of standard way to go. You want to lay your femoral straight over the top of the patella, and you can come around the back a little bit like that. You're not putting any tension on this. It's just sticking to the skin. And then you grab a length of your rigid strapping tape and just rip a piece off. So with your rigid tape, you want to pick up the outside edge of that patella. And then with your thumb, you fix this edge of the tape in. Then with your thumb, you're going to pick up the patella and slide it across this way, like that. And at the same time, you're going to grab a little bit of the quad with your fingers so that when you lay the tape down, you should have a little bit of puckering of the skin. And so how hard you pull depends on the symptom response, how it feels. So it's always good to test it, and then you might need a bit more tension or less tension depending on how the symptoms feel. And you can do a second one just to secure that. So same deal, if I wanted this to be a stronger thing, I would pull and gather again and try and get more puckering through there so that it goes on a stronger pull across, or you could leave it at that or do a little bit less. And that's your McConnell's tape. You can seal off the edges if you wanted to avoid it peeling up, but that's it. It's all about changing the symptoms or the pain in the knee. So the amount of tension and the angle you use depends on the symptom response that you get.